a medical core, especially for those who are into a lot of sporting activities. Physiotherapy is the rule of the game. Even before your medical experts do come in, the physiotherapists are always there. We're talking about physiotherapy and just how it's important for sportsmen, but also for you and I. Let's watch.
Therapy means treatment through physical modalities. It may be light, it may be electricity, it may be manual mobilization, it may be ultrasound, waves, rays, everything. So this entirely is physiotherapy, but not the muscle-kinesitherapy that is in Cameroon. Even in the surgeries, sometimes there is no need of surgery, but there is need of physiotherapy. But wherever there is a surgery, physiotherapy is must. There is pre-operative physiotherapy, post-operative physiotherapy, and then there is specializations after bachelor's. You can do masters in cardiorespiratory, pediatrics, neurology, orthopedics, sports, and even gynecology and obstetrics. So it's really everywhere. Physiotherapy is almost at all the aspect of the medical care. First of all, why people are not understanding? Because our physiotherapists are not efficient enough. Let me just go a little bit backward in the history. The physiotherapy in Cameroon started in around 1982, 1984 when there was polio outbreak. And the French people came and they taught, let me just add, the French is still very behind when it comes to physiotherapy. Since nowadays they have started going to the WCPT conference. The WCPT is our international organization, international confederation. So now they are trying to add it up. So they are mainly muscle-kinesitherapies. First thing, muscle is massage. That's not a part of physiotherapy. Yeah, we study a bit of massage just like we study a bit of medicine and surgery, but we don't do that. Then kinesitherapy, this term itself has a problem because kinesitherapy is movement therapy. And physiotherapy is vaster than movement therapy. Movement therapy is a part of physiotherapy. So now we are trying to encourage them to use the machines and all, and more important than the machines is the manual therapy, not the massage therapy, but the different kind of mobilization. So I'm sure when they start seeing the effect of physiotherapy, definitely they will start becoming aware. Just like we went to I went to Yaoundé in l'Hôpital General, and I treated almost 7-8 patients who were available there, and I trained the students there, I trained the therapists there, and they treated even 3 months old knee pain, 10 years back, back pain within 5 to 10 minutes. And this all is documented in the video. So this is what we are trying to do. So now I'm sure the patients who got the treatment from physiotherapy and they got the relief, if anyone in their surrounding is ill or sick, definitely they will refer the patient to the physiotherapist. So I think firstly we should improve ourselves, and then only the awareness will be created. If there's anything concerned with your pain or weakness or any dysfunction, physiotherapy is important. Like neck pain, back pain due to any reason, cervical spondylosis, spondylolisthesis, a lot of conditions are there. In neurology, the paralytic cases. In cardio, your chest infection, lung infection. And let me just add one thing. It's physiotherapy, not physiopathy. Pathy means the treatment of everything. For example, even you can treat fever with pathy like homeopathy, allopathy, this modern medical system. But therapy is assistive. It goes in collaboration. So actually it's a part of the team, of the medical team. Let me just demonstrate a session of physiotherapy with one of your crew. So we always start with the introduction, but you already know me. So we'll start from the assessment and evaluation, and then I will apply some manual therapy techniques after the diagnosis. Because until I diagnose what's exactly happening, I cannot treat her. So I'll take few minutes of yours in evaluation. Again, this is Dr. Krishna. So can I know what's happening in your neck?
Each time I work and I want to get up, my pains, I cannot turn my neck left or right, especially when I sleep.
Since how long you are getting this problem?
So it's 1 year now.
I would like you to bend the neck and see if it's painful.
Yeah, it's painful when I bend.
Pain is there somewhere around?
Yeah, somewhere it's here.
Okay.
And at times it's so crazy.
Okay, alright. Just extend your neck backward. It's painful?
Yeah, it's painful.
Okay. Just bend to the side. Okay. Most probably the muscles went in spasm, means they contracted, and since then, because of these spasm, the spinal alignment, everything became wrong. Now I'm going to apply a technique. It's called fist traction. because just relax, bend it. Now his spine is misaligned, so I'm just going to, is it painful? Mm-hmm. It's very painful when I'm doing this? Okay, relax. Now, quite painful. The pain is less or the same?
It's the same.
It's the same. Now? It's the same? Okay. Now bend the neck again. Let's see the pain. The pain is better? Is the same?
It's a little bit better.
It's a little bit better, right? Because I try to open up the posterior facets. So let me apply it again a bit more. Though it's very chronic problem, so we definitely need some more sessions. We cannot manipulate the spine every day. It should be done just once in 3 days. Now bend your neck and let me know the pain. You're feeling better? Bend the neck again in the front. Let me see the pain. Now let me just go behind.
Behind?
Yes.
No.
You don't have any particular reason? Is there any pain now? Okay. Around here. Okay, this is more because of, if you see her posture, her neck is in this position. Chin is protruded because these muscles are tight. So definitely she needs a really good session. But let me still try to mobilize the spine a bit. Because, do you feel the pain sometimes here? Okay. Do you feel sometimes pain here? A pinpoint pain? Yeah, because it's all, entire muscle. There's a lot of spasm over there. So let me just mobilize the spine a bit. Okay. I'll ask you to extend the neck. Okay. If it is painful, you'll not extend. If it's not painful, you'll go ahead. Okay. If it's painful, you'll just come back. Okay. So relax, relax. All right. Extend the neck. No pain? Go back. You see, so I'm just mobilizing the spine. Okay, we need to do it just 3 times. Okay, go back. We cannot mobilize it more than 3 times, so there's the come back. And the last time. Come back. Okay, now extend your neck and let's see. Extend your neck backward. How's the pain?
It's free.
So actually this fidget it's just one of few techniques, but yeah, but we really need to evaluate her well because these muscles are quite tight and will take some time. If you have a pain or paralysis, do consult a physiotherapist.
Interesting indeed. Okay, lots of issues about physios, right? Some will make you laugh, and the whole issue of being touchy, right? Yeah. They say that's the rule of the game. If you are in certain professions, you just cannot afford not being touchy sometimes. Cameramen, like journalists, will do whatever interpretation they want to do. But that's how the job is done. Okay, I'm coming to